is about Bachelor of Applied Science, and she is a environmental health speaker and consultant specializing in toxicity, interaction between environment and human health. She provides services, consulting services to private and public sectors since 2003. Let's welcome, please.
All right, so I am going to be talking about pretty much where all of you work, as long as you don't work outside. So indoor environments. And I'm speaking about scent-free issue, and this is primarily about the optional use of fragrances at work. Okay. These are the kinds of environments that I'm speaking about, open cubicle environments, which is the norm in Canadian workplaces. And some of them are very high density workplaces like this. Okay. So I'm going to be excluding, I don't work with employers in manufacturing where the chemicals from the manufacturing process might be coming into the office areas. And food smells is a little bit of a different area also. So about myself, I was diagnosed with this medical condition called multiple chemical sensitivities in 2003. I was in my late 20s at the time, so I have not been doing this since 2003. I just want to make that correction in the introduction. And yes, I am an environmental health specialist. I work consulting for both private and public companies. And it could be small or could be very large, like the government of Canada or Ontario. I'm here presenting on a general interest topic today. So in terms of my audience, I'd just like to know, if you could raise your hands, who is dealing with odor assessment and monitoring? Okay. And indoor air quality. All right. Involvement with the scent-free issue. Has anyone ever been involved in this issue? Okay, about 5 people. All right. And has anyone ever heard about this condition, multiple chemical sensitivities, which is also known as environmental illnesses? Okay, great, thank you. So the medical definition is that it's a disorder acquired in relation to some documentable environmental exposure, insult, or illness. And this could also be a stressor of a psychological nature that triggers it. Symptoms occur and abate in response to predictable stimuli. And symptoms are elicited by exposure to chemicals of diverse structural classes and toxicology modes of action. Exposures that elicit symptoms must be very low. That's part of the definition. And by that, it means that it's not average and not known to cause adverse human responses. And there's no single widely acceptable test of organ function that can explain the symptom. So in Ontario, we have the Women's College Environmental Health Clinic, which is the leader in the province of Ontario. What they do is they will have 1 or 2 appointments with you. They will not provide any kind of treatment. They will just diagnose you with an environmental illness or multiple chemical sensitivities if that's indeed what they think you have. And to get to them, it's over a year waiting list. So this is what people with this condition are going through. So what is happening is we might be in this area down here, which is the healthy area, when we're feeling no symptoms, lots of energy. And then we might be feeling some minor symptoms. We don't really know what they are necessarily. They might be coming on so slowly that we don't even notice them. And then there is a threshold that gets reached. And that's what happened to me one day in 2003 when a coworker simply walked past my open cubicle environment, and I developed a sudden lung reaction, and ever since then I've had this condition. So that is, by the way, very rare to develop the condition suddenly. There's normally a progression like this in the development. So what is the layman's definition of MCS? It's an allergy, essentially. That's how most people can most easily understand it. It depends on the amount of exposure, and it's usually can be very minuscule, like I said, to the point where other people aren't even aware of the odor in their environment. Length of time of exposure, so let's say you're working in beside a coworker who is wearing the same fragrance every day. It might take a year or two for you to develop any kinds of allergic response to that, or it could be quicker. And the substance or mix of substances. So I will have only really 3 kinds of reactions. Heart palpitations is very rare for me to have. Lung reaction is usually the one I have, or sometimes it can be a headache, but that's quite rare. And a conventional allergy test is probably going to turn up nothing unless your symptom is actually some sort of skin condition. Most people do not have that. So what else is happening here? It's a sensitivity. And people with MS can perceive substances at several orders of magnitude lower than the threshold level. And indoor air quality testing is most likely going to determine that nothing is irregular and everything is within acceptable limits. So I can perceive mold, exhaust fumes, and perfumes very acutely. The findings that if you've ever been in a work environment where they have tested the indoor air quality, usually what the result is it'll say that the indoor air quality is actually better than the outdoor air quality, which is not very helpful if you have this condition, of course. What is happening? Also, the reason I have these pictures here is that we, people with MCS, are likened to canaries, the expression canary in a coal mine, when the miners would take, this was before the technology to sense the gases in the air, they would take canaries, and canaries have a very delicate and small lung system, so they would die if they were exposed to these kinds of gases. And I also sometimes feel like I'm a sniffer dog, because at the most acute point of my condition, I could step off the elevator onto the floor where I worked, and I could actually tell who was in the office just based on the small amount of perfume or cologne that they were wearing. So very, very sensitive. Why is this happening? It's believed to be happening because of modern living. So we have air pollution, we have water pollution, plastics contaminating a lot of our food and drink, and of course the quality of our food has been deteriorating over the years. Chemicals that we put on our skin, so a lot of this is done through self-poisoning, and we're becoming much more allergic of a society than we were before. I'm 40 years old. When I was a child, nobody had asthma, nobody had a peanut allergy, and now it's a very commonplace. And also, our use of personal care products is going up quite exponentially. Triggers. So this might be hard to see, but what I have up here is the indoor air volatile organic compounds. So this is one of the big stressors: new carpet, plasticizers, formaldehyde, fragrances, and mold. Solvents, so this is less likely in an office environment. Same with pesticides, not likely. Combustible related products, such as cigarette smoke. And in Ontario, we're actually now dealing with the issue of e-cigarettes quite a bit. They do emit also chemicals, and the provincial government has taken action to legislate the same use of e-cigarettes as regular cigarettes. And this is also likely to happen throughout Canada, with the Ministry of Health looking into it. Cleaning agents is also one, because obviously your office environment is cleaned overnight, and what are the cleaning staff using? Drugs and medical devices, I never hear about this aspect, and that's just the nature of my business. Okay, so for symptoms, we have a multitude of symptoms. In fact, most people do not recognize that they have this condition because the symptoms are very ubiquitous. And it could be anything from sinus pain, runny nose, headaches, gagging type sensation, that would make it more obvious to what the trigger is. Itching or feeling like your skin is crawling. People are likely suffering from symptoms much longer and they're often misdiagnosed by their doctors. So, for example, they might be told, oh, well, you have a migraine condition. Well, what is causing the migraines? That's what people need to find out. Same with asthma, and headaches might be dismissed as stress-related. There are all kinds of severity of symptoms, like things that you can see and things that you can't. So for me, you're never going to see me having a reaction. It's all internal response that I'm having. People have been known to pass out, black out. It affects your cognitive ability. People might be speaking and starting to slur their words. Cloudy thinking is also the symptom. And then here we have a woman who was looking through a magazine. They no longer have these in Canada, as far as I know, but the scent strips that you can open up with the perfume and cologne. So she had one of these, and this was her reaction. So and she had never had a reaction like this before. Again, a lot of it depends on the mix of chemicals that you're exposed to. One perfume might not cause any reaction, and another perfume could send you to emergency. In terms of prevalence and impact, unfortunately, it's mostly women that are affected. And as you can see by the slides, there's a lot of stressful looking women there. And that is one of the reasons why women are more likely to be affected. We have, just in general, we're working, we have children, we're taking greater responsibility at home. And also, hormones is also a big one. It's believed that this condition involves estrogen receptors, and that's why more women have it than men. Also, the stress from like not making as much money, a lot of single parents, single mothers, so all these things are contributing. And also, a really big one is the fact that women are using way more personal care products than men, although men are starting to use a lot more also. There's a worsening effect over time, so a lot of people will ignore this issue, or because it comes on so slowly, or they just don't know what to do with it, and it will take less time, usually in the beginning, to elicit a response, and then the more time that they're exposed, the reactions are going to happen quicker, and more types of reactions develop. So if you might be having sinus issues, and then you have lung issues, that kind of train. Mental health stressors are also going to complicate the condition. Now, this is not a mental health condition, but you can imagine if you're going to work every day and not knowing what you're going to be reacting to. And also the reason most employers call me in is because there's severe conflicts between employees, and employees just don't understand this condition. Okay, sensitization and MCS. So this is getting into more of the science of it. So what is happening is your brain is becoming sensitized to these chemicals, and it's reacting at levels that are no longer considered normal. Your body no longer considers them normal, like it's an invader. In immunology, it's called an allergy. And in MCS, what's happening is your brain is getting sensitized to many chemicals at levels that previously had no relevance. Here's an example of an animal study. So they were giving rats repeated doses of low doses of something that would cause seizures. And they found that eventually even a low dose would give a response to cause a seizure, when previously only high doses would give that response. Interestingly, there was no bioaccumulation here, that the rats were not accumulating this in their system. And the animal experiments also demonstrates that sensitization to one chemical, just like in humans, leads to increased sensitivity in other chemicals, and they could be completely chemically unrelated. So that is why I will have a reaction to exhaust fumes and mold, totally different. Perfumes also very different, although perfumes do use carbon-based fuels. Receptors and oxidative stress. So to bridge the gap between cells, our neurons have developed a chemical messaging system, lock and key system. And what's happening is people like me, our bodies are under a lot of oxidative stress, which causes damage to the mitochondria in the cell and other cell structures like the outside of the cell. And then there's problems with the messaging of the hormones and the neurotransmitters. Then there's this thing called the TRPV1 receptor that can be stimulated by oxidative stress, becoming sensitized in MCS. The scientific review of MCS patients is what they found is that oxidative stress is very common. And usually if you have multiple chemical sensitivities, you're also dealing with another type of health condition such as chronic fatigue and fibromyalgia. And you are more likely to have an abnormal genotype for detoxification. So your body is not getting rid of substances like an average person would. And once sensitization occurs to one chemical, as I said before, it's more likely to occur in another. So I underwent some testing, and the intention of the testing was just to see how sensitive I am, how quickly I can detect any gas or substance, just like I was mentioning how I can detect people in my proximity just based on their smell. And it was not a laboratory condition, but I was surprised nonetheless. So what happened was I was first using this plastic mask here, and this is a counterpart apparatus, also made out of plastic. And then here, the bag was with the gas inside, and then it was being slowly let go here. And what happened was that the smell of the plastic in the mask was completely overpowering to me, that there was no way that I could even sense what was coming through in terms of the gas. And so then we tried a medical grade stainless steel instead, and all I could smell was the stainless steel. So basically what my point is, it was completely ineffective, and this is what you'll find with testing with people with MCS. It's not logical, so anything that would work for other people probably wouldn't work. Okay? So to conclude, the solutions in this issue is to keep the person away from what is triggering their response, and hopefully that can be figured out what it actually is. Sometimes that's the difficulty, is figuring out what that actually is. Some creative solutions have been working from home, moving people around, although of course that causes conflicts often if you move people around, and creating stringent scent-free zones. There's a lot of employers who put in policies, but they do not enforce them. So that is not helpful. And what happens then is, and the reason I recommend people come to me as somebody who's an expert in this, is because fellow employees do not understand, they don't have empathy for the situation, and I come in there and I give some real life examples, analogies that they do identify with, and I basically present myself as I am, very healthy looking, but I can be very disabled by this condition. And what I do is make presentation to staff, usually human resources managers, and I work on policy development, general advice, and referral. So what I do is I have a network of people that I can refer the employer to legally. In Canada, we have the human rights legislation. This is a recognized disability, and this could cause a lot of problems for an employer if they're not dealing with it properly. And there's my picture for you have to deal with this issue properly, or it can bite you in the bum, which is an expression we have in Canada. All right, and now I'll take any questions.
Thanks for this great presentation. Quick question. Is it mostly chemicals, so with food cooking, like if you cook onions or spices, does that apply? I have a second question. I deal with this in projects too. Does deodorants, unscented deodorants and stuff like that, are they effective for your sensitivity? So those are my three questions.
Okay, so for odors can be a nuisance odor for people. Like most people don't like the smell of fish, but it's not actually like having an ill effect on their body, right? So oftentimes employers will say, well, what am I supposed to do? Get rid of the kitchen? I say, no, unless you have somebody with a severe food allergy where the odor of a food could give them a reaction, then that's where I am on the food odors. And in terms of unscented products, that's a very tricky question, and this sometimes causes the conflicts between the employees, is because employees will go and purchase things that say unscented. But unscented just doesn't mean truly unscented. Every chemical, every substance has some sort of natural smell, right? Like you might be reacting to the smell of bananas or something natural, but that is still going to have an effect on you. So unscented products are definitely better, but it doesn't always solve the issue, because oftentimes there are other chemicals put in the substance that mask the odors of the original substance. Okay?
I just wanted to also explain something. When we tested Liz, we only tested for detection threshold. So not necessarily that her detection threshold has to be higher or lower, I guess, that it would be a problem for her. We didn't check annoyance threshold and other things that Professor Jen was talking about in the morning. It could be that somebody is detecting at the same level, but the annoyance level is so high that probably our brain would just ignore that altogether.
And also, further to that point, it's possible that whatever the gas that was used might not be something I would react to. Because
well, we used butanol, so it's just an alcohol base.
Right.
So I probably wouldn't react to that. We didn't check with acetone, heptane, or something.
Yeah.
So,
but the point is, it like the smell of the plastic and the stainless steel was completely overpowering to me, so I wouldn't have smelt much beyond that. Any other questions? Yes? How common is the condition? Environmental illnesses are approximately 3% of Canadians have them, so that would be about 1 million Canadians. But that would include things like mold also. Yeah, it is getting more prevalent because we are becoming a more of allergic society.